distinguished guests, dear esteemed colleagues. First, I would like to thank the organizers because I feel really pleased and honored to be here. Not only we discuss HTA here, but also I'm in a country that I find it as a relative because I come from Turkey as a public health physician and health economist. And my purpose is to get you back to the topic innovation again. So it will be somehow a complementary presentation to the presentation of Iñaki. So what we will discuss is how innovations can be identified, assessed and recommended in HTA. Okay, it's difficult to present this in a nutshell, but we will try to understand what innovations are considered within the scope of HTA, how are potential innovations identified, what criteria are used to assess these innovations, and lastly, how are assessed innovations recommended for use. To achieve this goal, let's set a context for this and remember or emphasize what HTA is once more. It is a systematic, transparent, unbiased, and robust approach used to evaluate the properties, effects, and impacts of health technologies, inform decision-making in healthcare to promote an economically sustainable healthcare system, and examine the clinical, social, economic, and ethical issues related to the use of a health technology. But what is the importance of innovation in health technology? Innovations are beyond mere invention. Incorporating the dissemination and application of new technologies into healthcare system, significantly improving available solutions or completely replacing them. So innovative healthcare technologies can lead to transformative changes like enhancing patient outcomes, increasing system efficiency, and promoting equitable access to care. So the strategic incorporation of innovation through HTA ensures that new technologies are not only scientifically advanced, but also economically and ethically sound. From that point, in the context of HTA, innovations must not only offer advancements, as I said, but also align with the broader health goals of improving quality, accessibility, and sustainability of care. So, as Iñaki has already mentioned, there are different categories of innovations, including product innovations, process innovations, positioning innovations, and paradigm innovations. But why we focus on innovation? Why we need to do that? Because we have current gaps in healthcare globally. We have lack of accessibility and coverage due to geographic and economic barriers. We have variability in quality of care between regions and within healthcare institutions as well. Inefficiency of care delivery, such as high costs, lengthy wait times, etc. And health outcome disparities across populations due to socioeconomic conditions and demographic factors. So innovations carries potential impacts across the healthcare system in this term, like enhancing system-wide efficiency, improving efficacy of treatments, and promoting equity in healthcare. So I go back to the title. So we will identify, assess, and recommend how we will do this. For identifying innovations, we have, not ongoing, okay. We have methodologies that we use, like horizon scanning, which involves proactive and systematic search for emerging innovations that are likely to affect healthcare. Technology needs assessments, which are used to identify and prioritize technology needs within specific healthcare settings. Delphi method, often used for generating consensus among a panel of experts about the potential impact and feasibility of new technologies, and most recently, real-world data analysis, which leverage data from healthcare settings to identify gaps that can be addressed by new technologies. As a case study, which is well identified as innovation, I like these examples, like Google Health's AI system in diagnosing diabetic retinopathy. They interpret retinal scans with a level of accuracy comparable to human ophthalmologists. So it can significantly reduce the burden on specialists and expedites the screening process. The second example can be remote patient monitoring systems, which are identified as a key area of innovation as well. Due to their potential to improve chronic disease management, they enhance patient engagement, reduce hospital readmissions, and allow better management of chronic diseases. So what tools or technologies we can use for identifications? Of course, the new trend, AI, artificial intelligence and machine learning, may have important roles on this, and, sorry, it's not working. Big data analytics, and also real-world evidence integration. To assess innovations as the next step, we assess clinical effectiveness. So it's essential for determining if the technology improves health outcomes. Safety, it's critical to ensure that the benefits outweigh risks. We assess also cost effectiveness for determining the value for money. And patient-centeredness, which ensures the health technologies align with patient preferences, needs, and values. For the assessment, we have different models, like comparative effectiveness research, which involves directly comparing existing healthcare interventions to determine which work best for which patients and which pose the greatest benefits and risks. Secondly, multi-criteria decision analysis, shortly MCDA, which uses systematic approach for ranking and prioritizing alternatives when multiple criteria exists. And lastly, predictive analytics in assessment uses statistical techniques and models to predict outcomes based on historical data. Okay, after assessment, of course, that's the, in real life, most important side, the regulatory considerations. In general, alignment with regulatory standards ensures safety, effectiveness, and high quality with compliance with regulatory frameworks, applied by the national authorities. But for these kind of innovative technologies, we need something further. For these breakthrough innovations, expedited pathways facilitate faster review and approval to let innovative health technologies reach the market in a shorter time. And encourage more investment and focus on developing groundbreaking innovations. So these kind of strategies are crucial to balance the need for rapid access for innovative treatments with the necessity to uphold safety and efficacy standards. For this purpose, we can take digital health implementation as a case example. First, we need to identify it, so needs assessment should be done to pinpoint gaps in current healthcare delivery, and stakeholder consultation is an important step here to have feedbacks of the relevant stakeholders. Then for the assessment, we assess efficacy, usability, and regulatory compliance of this specific technology. And lastly, integration into existing framework with systematic incorporation. So basically, you can think about like implementation of a telehealth program for chronic disease management. I'm just trying to be quick for the time limitation, but we will have time to discuss further at breaks maybe. Okay, for the stakeholder engagement, it's essential for the success of HTA. It enhances legitimacy, transparency, and utility of assessment process, brings vital perspectives, contributes to a holistic evaluation of health technologies, and drives more balanced and impactful healthcare decisions. So every stakeholder has unique roles in terms of contribution to these processes. So mainly patients, clinicians, policymakers, and industry representatives can be stakeholders on these processes. But even at this stage, we may have challenges in recommending these innovations after our assessments. Like what? For instance, we can have a problem in balancing cost, access, and innovation, because we have cost challenges like high cost of new technologies, budget impact. We have access challenges like equitable access and healthcare disparities. And we also have innovation challenges like incentivizing innovation and regulatory and market challenges. Another challenge, main challenge, can be dealing with high uncertainty in early stage innovations. We can have two examples for these evidence gaps, like limited clinical data and predicting long-term outcomes. And the second challenge can be methodological challenges like adapting HTA frameworks and dynamic evidence generation. So we need to overcome these barriers with enhanced collaboration between stakeholders, adaptive regulatory frameworks, financial strategies to support innovation, and promoting technology assessment literacy. So, is it that much difficult? Of course, we have success stories as well for HTA recommendations. One is the HPV, human papillomavirus vaccine introduction in the UK is a good example because they involved this vaccine in their national vaccines programs, and it resulted in a significant reduction in cervical cancer cases among vaccinated population. Rapid integration of telehealth during COVID-19 is a good example because, I mean, the adoption of these kind of telehealth technologies is accelerated in this period. Due to lockdowns and beyond, it is utilized for the continuity of care. And lastly, more conventional approach, but, I mean, compared to other ones, but approval and use of biologics for rheumatoid arthritis. It significantly improved treatment outcomes and transformation of the therapeutic landscape. So for the closing thoughts, I think it's better to repeat about stakeholder engagement. So we have different representatives here, so I believe it will be good to have a call to action to achieve using HTA and increasing access to innovative technologies. We need to engage proactively, invest in HTA literacy and capacity building, support innovative funding models, foster collaboration, and advocate for adaptive regulations. Thank you so much for listening to me. I'm looking forward to discuss more.